What do you feel were the most important aspects in tonight's program in improving your awareness of scleroderma?
Just working as an interprofessional team, I think it's so important to be aware of their scope of practice and the best evidence-based practices and services that they can give their patients with scleroderma. I was definitely not aware of certain conditions that they face. I just knew about the disease about 4 weeks ago, so I've been researching on it, and I'm pretty familiar, I would say, with what nutritionists and dietitians can do, but I was not aware of what PT, OT, and pharmacists and registered nurses can do. So this was extremely helpful to be aware of those. So if I ever have a scleroderma patient, I can refer them to those proper services.
For me, I would say the most important aspect was to get that interaction with the patients, and more than one patient at that. You can read about this sort of thing in a book, you can get a lecture on it in class, but to actually hear firsthand experiences, to see the differences, to see the similarities, that to me is what really brings what I should learn for the future, and maybe identifying this in my own practice.
I thought talking to patients was really important. It's always good to get the patient's perspective on their specific condition, not just a general perspective on scleroderma, because as they were saying, each patient is different. So I thought that was really important. And then listening to the different disciplines, asking questions to the patients and what kind of questions they would ask them and what kind of questions I would ask them as a physical therapy student was really important in building this kind of interprofessional team as students.
So I thought it was really interesting to get perspective on a bunch of different healthcare professionals as well as patients. It's not a disease state that you see a lot in a pharmacy. Like I work in a retail pharmacy right now. It's not one of the big ones like hypertension or diabetes, so it's not talked about as much, but it's equally important, if not more, since there's no cure for it.
I'm Christy, and I would say that the most important aspects of it was very eye-opening to see what the patients actually have to live with on a day-to-day basis, especially with interviewing the patients, and it really brought the disease to life. I mean, you really see why every little aspect and every area of medicine is important to be collaborative in their care, because everything counts. And it's important to them, like one thing, it's all connected. And that's what I thought was really interesting.
I think just hearing all of the individual stories from every patient and how it is truly different for everyone, and how we as professionals can help them through that experience and maybe lead them to a diagnosis they may not have previously received because of this experience and exploration of their diagnosis process.
How will this IPE help you in future care of your scleroderma patients?
Yep, just to elaborate again, like I was saying before, I can refer them to the services that they need. Of course, we can only do so much in our dietetics and nutrition. We're all about evidence-based research, but if it's going beyond our scope of practice, like if they need help with activities of daily living, I would refer them to a PT or OT. If they need certain medications to help treat their GERD, I refer them to a pharmacist or whatever that may be. And of course, scleroderma, it affects everyone differently, so you need to take an individualized approach.
So I think the most beneficial is obviously at this school, we're focused mostly on pharmacy and doctor interactions, MD. So the fact that there was physical therapy, occupational therapy, nutrition, that would help me to say, if a patient came in, I could not only assess their medications, but, ask them, have you seen a physical therapist? Would you benefit for that? Maybe do you need to see a nutrition? We're told a lot that pharmacy is the most accessible healthcare professional. I think that this event really helped me learn how to use that access well.
I think it just brings awareness that interprofessional team is key to helping these patients manage their conditions. So in physical therapy, I can only do so much for them in the realm of movement, but if they're having other issues, or other problems, that I know that I have a team that I can send them to, and they can help them more specifically with things that I'm not capable of.
So I think it's really important to just have a good understanding of the different disease states that a patient could be facing. Like they said on the panel on the stage, as a pharmacist, you could maybe catch different medications, like if they're taking something for heartburn, if they're also taking something for their Raynaud's syndrome. That's something that you could maybe put together and help put that puzzle together quicker, since pharmacists are some of the most accessible healthcare professionals.
I think from talking to the individual patients that I talk to, it makes me more empathetic to the problems that they may have, and to know that it's very individualized, that the two patients that I did speak to, they both had very different problems, and to be aware of how encompassing it can be and how it can affect a different body part for each individual patient. And it made me more aware of that.
Kind of like I said, like it is all different, and just being able to talk to the patient, because they are, especially if they've been diagnosed for a long time, they are just aware and even more aware of their symptoms and things that work for them and things that might not. So being able to sit down and really talk to our patients and get to the root of things, I think is what I learned the most for working with patients with this disorder.
Do you have any suggestions for making this event even more valuable?
Good question. This is my first year doing this event. Personally, I thought the patient simulation was an excellent way to do it, just to see how appointments go for OT, PT, pharmacists. I was very unaware of that. Currently, I don't have any suggestions. I loved it all, and getting to know all the patients' stories and how it affects them and different ways they're managing their condition, and also giving them suggestions in order to help improve their quality of life.
Well, like I said, I was really big with the patient contact, so I would love if we could maybe stretch that out a little further, maybe get some more stories or do a patient panel, a little bit more informal, questions from the audience. I'm not sure how it runs, so I don't know the feasibility, but I just think the patient contact is really important, and we should get more of it.
Just my personal experience, we only had one patient, so it might have been our fault for not, I guess, raising asking someone, but so we had Amy, and so we heard her story on stage as well as on our table, which was really awesome. But as they were saying, each patient has a different experience, so it would have been awesome to hear more stories. So I guess maybe in the future you could do something where the whole audience is able to hear different stories, even just like tidbits or just small things, just to get everyone to hear the different progression of the disease and just the different scenarios that could happen.
I think having a lot of patient interaction is the really important part of it. Everyone has a different story, so understanding that everyone does have a different story, and it doesn't manifest as one set of symptoms or one particular disease state. So I think it's just important to have a broader understanding, and more patients allow for that.
I thought it was really good. As far as a suggestion, I would say if it had a little bit more information for each specialty as to what they may bring to the table. So when interviewing the patients, kind of what they could research prior to. The informational packets were really good, but then I had to do more information as far as what exactly it really affects from a nursing standpoint that the packets didn't quite cover, I guess. So I felt like if there was just a couple websites that you could go to get a kind of more broader view, that would have been helpful.
I think it would be great to even include more professionals if possible. We can see how medicine is going towards interprofessional teams, and that might range from OT, PT, speech, dietitians, and just maybe even encompassing more. We have so many opportunities in the area with so many different colleges. So just incorporating as many professionals as we can to truly make this an interprofessional experience.
Well, thank you very much.
Thank
Have
you.
a good night.